All right, so give me a little background on him. I know the whole catching him incident. He does not tolerate drugs at all. He just eats right through them.
Yeah.
Okay.
But he's used to running free,
Okay.
so.
And we don't know any history, right?
No.
No.
Okay.
Hey, boo-boos.
We know the people that saw him on the street saw him for at least 6 months.
Okay. All right.
Just roaming.
With the
Embedded
no.
collar.
Okay.
Yeah.
All right.
I still need to measure that.
He's on.
Yeah.
Okay.
Sorry, guys. Back.
Do you want me to start taking advantage of?
Yes, he's a little bit nervous around new people.
Okay.
He's not.
But he doesn't.
Not aggressive. There's no aggression.
He just
come out.
Yeah. He just.
Maybe
he
he'll
just
come to me.
Hi, Ben. Hey, buddy. And the Baytril dose.
The Baytril dose, he gets 2 pills.
Okay.
Once a day.
Okay. Also since Saturday.
Yes.
Okay. And trazodone.
Trazodone, he gets 50 milligrams. Okay.
50 a.m. p.m.
AM and PM and late night.
Hi, big boy.
He's used to bandage changes.
Yeah.
It happens every day.
Okay.
Yeah.
So
He knows what you're gonna do.
all I know, Dr. Chow had sent me some images when he arrived, and then I saw the wound progression a little bit. Give me a little bit of history of his time with her, as far as bandage care and things like that.
So it was every day, and then we attempted to go to every other day, and there was a foul smell. So we went back to every day bandage changes. They keep saying that the granulation looks good, that it looks good, but there is a smell, which is what caused us to do the culture and to start on antibiotics.
Okay, and has he been in the hospital this whole time, or?
No, he's with us.
He's with you guys, okay. How long was he at the facility?
Oh, God.
There or with
10
us?
days tops, a week.
And then he
yes.
came back to us.
10 days?
Probably about, yeah, close to 10 to
10
14 days,
Okay.
yeah.
All right.
And then he's been at the rescue house in a room. At first they said they believed that it was going to close, he wouldn't need surgery.
Yeah.
Then they realized it wasn't going to close. Then the smell came. Then they took a culture. Dr. Worley said she would have the results in a couple of days. Now it's 5 days. Started antibiotics because they didn't want to start antibiotics because they were afraid to do something, obviously, make it
Yeah.
worse for surgery and push the surgery back.
Okay,
But apparently they felt they needed to start the...
okay. And other than the separation anxiety, any other concerns with him?
No, he's perfect.
Okay.
He's just considering he's perfect.
Okay.
Just need to get this wound closed up so that he doesn't have to go every day
Yeah.
for them to keep wrapping and wrapping, and so and we can neuter him.
Yeah, I can get some adhesive remover.
Is it stuck on his neck?
Yeah.
Right. Oh, I'm sorry, honey.
Oh, what?
Umbrella. Do you want to sit here?
No, you're fine. Perfectly fine. Thank you. God, he's such a good dog to go through this, and not a snap, not a growl, ever from day one.
I know, you want to grab that. I know.
Feels weird.
It's like, is that something I can chew on? Hi, sweetheart. What a good boy. Yeah. Can I take a look at you? How is he with other animals?
He seems really want to play.
Seems like he wants to play.
Yeah.
Of course, we haven't allowed him to get close or do anything like that.
He was being fed. There were cats all around him, and he did nothing too. So look at that. Good boy. Hi, Red. You look like the flying nun. Hey, everybody. This is Amy with 100 Plus Abandoned Dogs of Everglades, Florida. As you know, we've been talking about Red. For any of you that are new or just jumping on, Red was living on the streets for as long as we know, 6 months or longer, with a puppy collar that he grew into his neck to cause him having an embedded collar. Good boy.
Yeah.
That's your new best friend behind you.
It's just going to make you all better.
Mm-hmm.
Oh, I forgot that part.
Oh, yeah. I was just going to
exactly.
I think he might have some kind of.
Disc or
What's she
something.
called? FC.
FCE?
Yes.
Oh,
Yeah.
really? What happened?
Just because he was when he came to the rescue house, when he was at the hospital, he was drugged and everything, so you didn't notice. When he came to the rescue house, I noticed after the first few days that he was like super wobbly. And I didn't know if it was the drugs or whatever, so I had brought it to their attention and she did an exam and she said one leg for sure.
Front or back?
Back. Like when he would run across the lawn.
I don't notice it
He would
either.
try to turn and he couldn't keep his feet under him.
See that?
And at first I just thought he was goofy, but.
But you've been walking him, he's been fine.
I've
Yeah.
noticed
Yeah, he walks fine, but I think it's those transitions.
But he drags too when he walks.
But has he ever been evaluated off of the medication? Off of gabapentin?
No.
Off of,
No.
Okay. And do they feel that it's gotten better?
She thinks that, yeah, the last time Saturday, she did another quick exam and she said she thought it was better.
It's a toy. You think
Yeah.
that's a toy?
I'll take that.
He's like a toddler, everything goes in his mouth.
He is. He's
You're
like a big
cute.
baby. He's a big baby.
You are a big baby. Thank you so much.
Oh boy.
Since it's good, we can use it.
So trusting. So
It's
so
unbelievable.
It is amazing
Yeah,
considering
especially
what
after
he's been
he's
through.
I know, you wanna take that off. I know.
She's gonna take it out.
We're trying to get it off.
Yeah,
Good
that stuff
boy,
is a godsend
Red.
sometimes.
Good boy. You're such a good patient. He's been through so much.
Yeah, I'm so happy you guys finally caught him.
Oh,
You're not the only one.
How many times was it?
many.
Yeah.
2 months.
Traps.
Like 10, yeah.
Food.
Oh, the 2 week of trap
Right.
before anybody even knew about them really.
And then came the cocktail and the nets.
Times 3, wasn't it? I did it 3 times? Twice?
Twice.
We did it 3 times.
3 times.
3 times.
So much.
With the right cocktail.
Yeah,
Third time's a
he
charm.
was definitely smart. That's for sure.
That's all he knew was survival on the streets.
It looks so red.
No pun.
Red's good though.
No,
Yeah.
no,
No, where they're
Oh,
taking the
tape. Oh.
tape off. You look at how good this dog is.
I know. It's amazing.
Every day
So
he goes through this.
amazing. Red needs a home. He needs a person. After all he's been through, he needs a loving
He's such a good
home.
boy, so sweet. Good boy, but he ain't no baby. He's not big for.
It's really not.
What should he weigh, Tiff? Did they tell you?
The other day, I think he was 62, 63.
They're just trying to get the sticky tape
I know,
off
it's
his
not-
neck.
Yeah, still a little thing.
I know, but I know.
And
I
while
know
we're
you want to chew on that. Yeah.
while we're here doing Red's exam with Dr. Babevsky,
I think I'm lucky.
Jamie was here first, the little dog we rescued from Miami-Dade. Yeah. Wow.
That's not a good thing.
That's a lot when a surgeon says, wow.
It's okay, big boy. It's okay.
And who is primary doing the bandage? Is it Dr. Trow or
Dr.
Worley?
Trow and Woolery, Wednesday through Saturday. And then
Whoever's there Tuesday, whoever's there.
And if they try to go every few days, is
No,
it
smelly.
wet?
It bleeds through.
Bleeds.
And then.
And it falls off.
And then,
Okay.
that was when the smell,
See how deep that
Because
is?
it wasn't really covered.
yeah, a couple times the bandages weren't
Yeah, it wasn't wrapped properly.
proper.
It's pretty deep, right?
Oh, it's just, a pretty significant cosmetic defect, but we can absolutely fix this. Good job, buddy. And the initial wound, I'm assuming, was much larger than this. Because I never saw it, only in photos.
It was not really. It was the
Okay.
same size, it was just different looking
Okay.
Yeah.
because it wasn't clean. Listen, when we were trying to catch him
Yeah.
and he would run away from us and just run by us, the smell would
Really?
linger. It was like a dead person, right? It was
Oh
so,
God, you can smell.
you could smell
Laid
him.
in the bushes.
Oh, it
And
was so
deeper
bad.
than this as well, or?
It was just, I don't think it was deeper, doctor. I think it was just different looking because it wasn't clean and it was nasty. Wasn't cared for.
He's such a good boy.
And that's the,
No, you're okay.
Can you imagine?
I'm grabbing some photos from my phone.
I know you don't like birthday. Just let me know if you want me to lift higher.
Nope, you're fine.
Okay.
Doesn't smell at all today.
Awesome.
Good.
Maybe the antibiotics are helping.
Yeah. Now, once he was changed yesterday.
We decided not to do today because we knew he was seeing you. But normally he would have gone today.
Yeah, I can see. All right.
I know, baby boy. I know. She's gonna fix you up.
Trying to get the side, how far it extends on the side of his neck. Okay, so what we're gonna have to do is we need that culture. We need to see how resistant of an infection he has, so that hopefully should be back. If they don't have any preliminaries, we should definitely have results this week. And then the wound itself looks beautiful. They did an amazing job. What we're gonna have to do is basically cut along the entire perimeter of the entire wound and
pull that
reattach
down.
this to here. Yeah. And you know what's happened is that he's healed in an appropriate fashion for the location. Normally they're going to form some scar tissue when they have a wound this severe and this deep, and this kind of puckering now is just contraction. The body is doing its best to make it close, and unfortunately, because the collar was so deeply embedded, it's really quite difficult for this skin to meet back in this location. It just doesn't, it can't find its way. It's too far apart. So our job is to kind of reapproximate those areas, and he'll have a normal neck again. Did they take?
So there's enough there to join it?
Oh, there's
Doesn't
plenty.
need graft.
Yeah,
Awesome.
yeah, because you know, so the dissection is a lot because we literally have to, like I said,
Cut
you
away
cut.
all that.
You don't cut it away. You just kind of make a new incision, and then what we call undermine. So we basically want to pull this
that
skin away from the wound, all along the entire perimeter, and then just literally reattach this. But what I'm really happy is that he has like a big dewlap, like in a rabbit, and that just gives us a lot of leeway to get this reattached. So the issues that you know that are going to be most apparent is just infection. He was infected for quite a long time, and the wound looks beautiful, but you know we worry if having a resistant type of bacteria. So we want to make sure that before we close it, we're on the right antibiotics. The second issue would be dehiscence or breakage of the incision line, and that's just because it's in an area where he's constantly moving, and it's really difficult to immobilize this area completely. So, he'll definitely have some kind of bandage on, but we won't be changing it as frequently as they are now because the wound will be covered and closed.
Is there anything they could do, like as far as like a brace to go over
Well,
it, so you can't really
if it was a little higher, yes, but in this location,
It's so low.
the problem is that the brace will probably end right at the
there.
wound, and it makes it worse. So I know you want to smell that, huh? But it actually looks really, really nice. They did a fantastic job. So really now it's more of just a cosmetic issue and functional, and we can fix all of that.
Awesome.
Yes.
Yeah.
Yes.
So,
Now the big question, when?
yeah.
You hear that, right?
So
Depending on when
need
we get the culture back,
Yeah. So I'll talk to them today.
It was Dr. Worley that
Worley.
sent it out.
Okay.
She told me it'd be
Did you
back
set
by
up that
Saturday.
Well,
Then she said Monday or Tuesday.
yeah.
So
It all depends on what's growing because sometimes something
it
will
takes
grow
longer.
immediately and they'll be able to say, yep, there's something on the plate. It's in this category, but we don't know. We don't have the final yet. Some bacteria take longer to grow. So that's kind of what we're waiting on. But they could at least call the lab and just see if they have any preliminary information, and that could guide us. But yeah, the fact that he had an infection for so long, what we don't want to do is go through the surgery, get it closed, and then it breaks open because it's infected.
right, for
So,
sure.
Yeah. So unfortunately, we're gonna have to do a few more bandage changes on him, and
Okay.
then get him taken care of. I know. Yeah.
You guys can bandage him up today,
Yeah,
right?
So you can eat it, okay? You can smell it, but you can't eat it.
No,
I know, it's really
no,
weird.
no,
Yeah,
no,
it's
no,
like licking it,
no,
Oh, you can't
yuckies.
lick it.
No, no,
It's not
no.
too gross.
Yeah.
You good boy. Doesn't smell now, so that's good.
Doesn't smell at all. Yeah, and no fever. Now, have they had issues with the bandages slipping?
Yes.
Yeah.
That's why
Well-
depending on
Like that.
who did it.
It depends on who does it.
Okay, so the Elasticon seems to be the best route for him.
Trow and Worley.
Okay. Did they ever try like a stockinette around his neck? Did that seem to help, or
They actually have really big ones here. Like we can maybe even make
Any
like
results?
a shirt like over his front legs.
and maybe they could change it. All right. So let me take him the back. We're gonna see what we can do with the bandage, and what I'd like to do is if we can fashion something where you guys can just change it daily, I'm okay doing that for a few days.
We can't.
No.
No.
Change a walk.
No.
No.
We need to take him in.
Okay, alright, no worries.
Yeah, we're gonna have to take him to LVS to do that.
Okay, no worries. So, let me take him
We
to the
have a
back.
few more days of bandage changes till we get the result.
What if it's not like a bandage that we just remove? What if it's something that you guys literally just kind of take down and take out, like a washcloth or something, and then put back on?
We just have to watch you and make sure it's gonna stay on
I
him.
think he
rolls. He rolls. He gets it off.
He does.
And he shakes like that a lot.
We can't let that be open.
He shakes and he rolls a lot, so like when that's not done properly by
Yeah.
them, it
The
gets
spinal.
stuck. Like it squeezes down and
Trust me, we've been going through this every day. For 2 weeks.
Yeah. It's your dewlap, huh?
You do that.
Yeah. It's your
You
Well, the good news is the wound now has a very healthy granulation bed. That tends to be a bit resistant to bacteria. So we're good.
Awesome.
So, the wound compared to what it was initially, we're in a completely different ballgame. So if he perhaps gets it off, even if he rolls on the ground, it's not going to turn into what it did before. Okay?
Good.
So, all right, so let me take him to the back. We'll get him all cleaned up.
Okay.
No, we'll leave him later. Okay. All right. We're stealing from you guys.
He's a lot bigger than you.
All right.
Here's the.
Thank you.
Yeah.
Very
Bye, Red.
He is very sweet.
Very sweet.
Okay, so we are here at Heroes with Dr. Babevsky. For all of you that are, I just went live and I didn't really give any detail what's going on. So Red is getting ready to have surgery, not today. We're trying to get a day scheduled for when her schedule's available and have that neck closed up. We don't have an estimate, we don't know anything yet. We're just here for the consult to get him in as soon as possible. Prior to Red's appointment, we had Jamie, the little senior we rescued from Miami-Dade. He has a bilateral perennial hernia. He is in excruciating pain. Dr. Babevsky looked, and she doesn't have time to do it for probably a week. He can't wait. So Leslie just rushed Jamie to Coral Springs Animal Hospital to get him in for surgery ASAP because he is in excruciating pain. Can't wait another day, honestly. So that's where we're at with 2 emergencies. And then a third dog is Benji that we took in, abandoned on the streets of Hialeah. He's been in a foster to adopt, but he's limping. We had x-rays done here, waiting to see what's needed for him. So we have 3 dogs with some serious surgeries needed. So
the surgeon now, so she's very curious as to what's going on too.
nothing back yet.
Okay. All right, thank you. Okay,
What'd they say?
nothing yet.
Who was that? Who was that you spoke to?
Kim. Oh, yes.
Did you ask to speak to the doctor?
No.
Who's on today?
One of the new ones.
Okay. All right, so I need to go make some phone calls to
For Jamie.
for Coral Springs to get him set up for surgery, and I need to call LVS to speak to the doctor to see if we have any results on Red's results for his neck. So, nope, never ends. So that's why we're sharing all this with you. Happy Monday. So please, if you can make a donation, we will update more when we know more on what's going to be needed and what the cost of all these surgeries will be. Signing off, 100 Plus Abandoned Dogs of Everglades, Florida.